I'm Andrew Kaunitz, Professor and Associate Chair in the OBGYN Department, University of Florida College of Medicine in Jacksonville. Today I'd like to discuss follow-up of women with benign ovarian cysts. Ovarian cysts are common, the great majority are benign, and more than 3/4 of benign cysts will resolve over 5 or fewer years. For more than 3 decades, the University of Kentucky Ovarian Cancer Screening Trial has performed serial transvaginal ultrasounds, or TVUS, at no charge on almost 48,000 women aged greater than 30 years. Among these women, over 2,600 or 5.5% were found to have new ovarian cysts. In a recent report published in ACOG's Green Journal, the Kentucky-based investigators described the trajectory of cyst resolution among women noted to have cysts with benign characteristics and point out factors associated with time to cyst resolution. Characteristics associated with benign ovarian cysts include smooth, thin walls, lack of solid components or septations, and minimal, if any, blood flow when assessed with Doppler. In contrast, characteristics associated with malignancy include increasing cyst size, presence of papillary or solid components, irregularity of the ovarian mass, presence of ascites, and abundant blood flow with Doppler. 2 groups of asymptomatic women were enrolled in the trial: postmenopausal women aged 50 and over, and premenopausal women at elevated risk for ovarian cancer due to family history, BRCA mutations, Ashkenazi heritage, or Lynch syndrome. Women with normal TVUS findings were rescreened in 1 year. The mean follow-up time of trial participants was almost 8 years. Of the over 40,000 women without cysts on initial TVUS, cysts were not subsequently identified in 93.5%, while new or incident cysts were identified in the remaining 6.5%. Of these women, cysts resolved in almost 2/3, leaving 971 women with persistent cysts. Among all incident cysts which ultimately resolved, median resolution time was 14 months, with almost 2/3 resolving within 1 year. Women with cysts that resolved were younger than those without resolution, with mean ages 53 and 57 years respectively. Smaller cysts resolved more quickly. Median time to resolution for cysts up to 3 centimeters, 3.6 centimeters, and larger than 6 centimeters was 1.6, and 3.5 years respectively. With multivariate analysis, septated cysts were more likely to resolve than simple cysts, and neither BMI nor family history of ovarian cancer predicted time to cyst resolution. Based on the median time to cyst resolution, the authors recommend that surveillance continue for 6 years for those with simple cysts, 4 years for septated cysts, as well as for cysts smaller than 3 centimeters, 6 years for cysts 3 to 6 centimeters, and 14 years for cysts larger than 6 centimeters. We've come a long way from the time when surgery was recommended for any postmenopausal woman found to have an ovarian cyst. Based on a unique database, the information in this article allows clinicians and our patients to make evidence-based decisions regarding ongoing sonographic follow-up versus surgical management of women with benign appearing ovarian cysts. I'm Andrew Kaunitz. Please take care of yourself and each other.